Okay, so now when we've gathered the information we need from the FMS, we're going to put that onto our program design notes template and send that over in an attachment to Matt. So what goes on with the program design notes template? The top part is our scoring system. The deep squat, it's going to give you a left and a right side for the score on each one, and then a total to the side. So what you'll see is on your deep squat, there is no left or right. You just put a score and then put the total score out to the right. On your hurdle step, you're going to put the score from the left, the score from the right, and you'll take the lowest number to make the total. So if they got a 3 on the left, a 2 on the right, it's going to be a total of 2. Same if they had a 2 on the left and a 1 on the right, it's going to be a total of 1. Same thing with the inline lunge, the left or the right score, take the lower score as the total. Shoulder impingement, positive or negative, and indicate which shoulder you're talking about. The next area below there is basically comments from the FMS and or the workout. So during the FMS, if you see something that is of necessary information to write a program, if they got a 1, maybe the reason why they didn't get a 1. Was it because the bar was in front of their footprint with compensation, or was it that they didn't reach parallel? That might be something that Matt would like to know during that. If they did feel pain in some area, where did they feel the pain would be another piece of pertinent information that would go. If you get a perfect score, or if it's just a common score of a 2, sometimes I do list where something happened. If we had internal, external rotation of the hip during the hurdle step, or at what point did they lose contact? Did they lose contact on the inline lunge? Did they lose contact at the lower part, which you call the sacrum, is the most common thing, or could they not complete the movement because they couldn't get all the way down on the lunge? Okay, next part, of course, you'll just put the information about the client's name and the length of the program, how many times per week, indicate whether it's semi-private or one-on-one, and you may also want to let them know what group, if he's already written a program for a previous person that they're now joining the group with, if you happen to have that information. If they're joining with a friend and they're going to be with Kim Smith, let him know that Kim Smith, this is with her, so things make sense. Then after that, you're going to know that he needs to know who the trainer is and their trainer's email. So he'll have those as he goes, but it's important to let him know who the trainer is and the trainer's email so he can send it to them. If you don't know who the trainer is going to be yet, but you're sending off, then just let him know trainer to be determined, and he can send it to you. That way you can print it out. Then at the bottom of the sheet, you'll have an additional comments area. That may be where information you want to put, like what this person's measurements are, height, weight, age, and maybe the body fat percentage you got with the handheld bioelectrical impedance body fat meter may be of additional use for him there. You can tell them any kind of other additional things that maybe they want to know. They definitely want to know their goals. You can list fat loss, muscle gain, maybe how much fat loss, but generally just their top goals that you're going to say: fat loss, muscle gain, and then at your health risk area, you'll want to indicate high blood pressure, hyperthyroid, those common things that you're going to see on the HHQ. And most important would be any kind of injuries that this person may have dealt with in the past, whether it be a knee, ACL injury, or some kind of lower back or some kind of spine injury in the past. Make sure that's noted on there just so things can be taken care of and avoided appropriately.